Hi, in this video lecture, I am going to discuss about HIV and AIDS. HIV is nothing but human immunodeficiency virus. So HIV in India is rapidly moving from beginning a primary urban disease to the rural communities. Prior to 1992, it was mainly seen in males who migrated to the urban centers, but it is a serious social issues arises due to drastic spreading. The infected HIV will leads to AIDS disease, acquired immunodeficiency syndrome. Human immunodeficiency virus is an infection that attack the body's of immune system, especially the white blood cells called CD4 cells of WBC is severely affected by the HIV infections. So the HIV destroys the CD4 and weaken the person's immunity against the infections such as tuberculosis and some cancers. If the infected person's CD cell counts fallen below the 200, their immunity is severely compromised, leaving them more susceptible to the infections. If CD4 count is below 200, is described as having AIDS, acquired immunodeficiency syndrome. So you know that 8.1 million people living with HIV did not know that they have HIV affected, as per the 2018 survey of WHO. And then 37.9 million people were living with HIV in the world. So it is one of the serious social issues. It affects the younger population, so automatically the human resources can be degraded. So what are the symptoms of HIV and how the tests can be carried out? The only way to know the infected persons be tested for HIV infection. Already given the data, many millions people didn't know whether they are infected with HIV or not. What are the warning symptoms or signs of HIV infected person means? First thing is a rapid weight loss can be occurred and continuous dry cough, fever, and night sweats, and unexplained fatigue, swollen lymph glands in the arms, neck, and diarrhea. At least for more than a week, a diarrhea is happened, and white spots or unusual blemishes on the tongue, in the mouth, or in the throat. A pneumonia fever, or a red, brown, pink, or purplish blotches on under the skin or inside the mouth, nose, or eyelids. Even a memory losses can occur, depression, and other neurological disorders. These all are the symptoms. So once on getting the symptoms, it is not HIV infection. On taking HIV test only, we can confirm whether the person is infected with HIV or not. Especially the younger generation must aware about the HIV and AIDS. So if in 2019 you know the outbreak of COVID, like that in 19s, the outbreak of HIV will impact the world. The human resource is very much affected on the spreading of HIV and AIDS to the younger generation. So, what are the tests should carried out to find the HIV? There are different types of tests are carried out. Only through the blood test we can test whether HIV is positive or negative. The first test is antibody test, can be rapid test, ELISA third generation test. It takes 23 to 90 days to find the result. And next test is antibody and P24 antigen test. That is ELISA fourth generation test. It takes 8 to 45 days to confirm the HIV infection. And then advanced test is PCR test. It will take 10 to 33 days to confirm the HIV contamination. So, how the HIV can be transmitted? So, you are well aware about the mode of transmission of HIV. There are many reasons of that. The important reason is the HIV transmission majorly occur when a body fluids of an infected person can enter into the body of an uninfected person. This is the major reason of transmission of HIV. Especially, these body fluids can be transmitted through a sexual intercourse. The most common ways that HIV is transmitted from one person to another person, apart from the sexual transmission or sexual intercourse, by sharing a needles or injection equipment with injection drug users who is infected with HIV. So once a person is infected with HIV, they use the syringe, they use the needle. That needle can shared by some other person they are infected with HIV. So this is also one of the serious problem. And also the HIV infected woman, they can transfer the disease or the infection to the babies before during the birth. And also through the breastfeeding after birth, the woman can transfer the infection to the baby. And also it can be transmitted to the transfusion of infected blood or blood clotting factors to the uninfected persons. So recent case studies clearly shows that even in a recent technological arena in Madurai, 3 months before, a pregnant woman received the infected blood. So it shows our testing facility. So we must be cautious about during blood transmission. The transfusion of blood is also a mode of HIV infection. Some healthcare workers have become infected after being struck with needles containing HIV infected blood or less frequently. It does not occur frequently, less frequently. And also the workers open cut or through the splashes into the worker eyes or inside his or her nose, it will contaminate or it will leads to infect the HIV. So these all are some of the mode of transmission of HIV. And next you come to the what are the ways to prevent the HIV infection. There are many preventive measures of that. So first thing, the HIV is transmitted through a sexual intercourse means so we can avoid direct sexual contact to the infected person or unknown person. Better you use condoms for that condition. So it acts as a barrier to spread the virus. Instead of sharing the needles, we can go for a disposal needles, use and throw needles. It will prevent the HIV transmission. So by transmission of HIV infection from mother to infant nowadays can be prevented with advanced treatment techniques. So we can go for that ERT technique. By this way, we can control or you prevent the transmission of HIV infection to the mother to infant. And also, during a transfusion of blood or organ to the uninfected person, normal blood transmission can be screened properly and thoroughly. After that, only we can give or transmission occurs. So by this way, we can prevent. Apart from this, we can have some education, proper knowledge about the HIV. These things, when these things make them to aware about the HIV, prevent them from HIV infection. And last part is treatment and care of HIV patients. Treatment and care, it is very important. HIV treated with antiretroviral therapy (ART). Antiretroviral therapy consists of one or more medicines. It does not cure HIV but reduce the replication of virus in the blood, thereby reducing the viral load to the undetectable level. So ERT enables people living with HIV to lead healthy, productive lives. It also works as an effective prevention, reducing the risk of onward transmission by 96%. ART should be taken every day throughout the person's life, the infected person's life. They are taking the ART treatment, they are taking the course. People can continue with safe and effective ART if they adhere to the treatment. So this is the only method available to manage the HIV or AIDS disease. So in case if you are not able to take the ART means, people will need to switch to other medicine to protect the health with consultation of physician. So with this thing, I will come to the topic. These all are the references I gone through. Thank you for your patient listen. Thank you very much.